Medicare and Medicaid, general information for individuals with intellectual disabilities living in a home or community setting. I'm only speaking about individuals who have an intellectual disability significant enough to live in our program. Most of our individuals also qualify for low-income benefits. Information I explain here may be different for someone without an intellectual disability, in a different income bracket, with a different work history, or live in a state other than Louisiana. Who qualifies for Medicare? Our folks usually qualify for Medicare in one of two ways. If the individual is under 65, they become eligible for Medicare if they have received Social Security Disability Insurance, SSDI, for at least 24 months, or if they have been diagnosed with end-stage renal disease. The other way our individuals can qualify for Medicare is when they start receiving supplemental security income when they turn 65. A consumer who is under 65 years of age may be eligible for Medicare. I've often wondered, why do some of our individuals have Medicare and some do not? All individuals qualify for Medicare when they turn 65 years old. However, some can get Medicare before they turn 65. In order to qualify for Medicare before you are 65, you must be receiving Social Security Disability Insurance, SSDI. SSDI is only available to those who have worked and paid into the system. Most of our individuals are not able to assemble the necessary work record to qualify for SSDI on their own. However, individuals may qualify for SSDI on their parents' work record. Individuals who qualify for Medicare before turning 65 have a parent who has paid into the Social Security system. When a parent that has paid into the system starts to receive their own Social Security benefits, which usually happens after the parent retires, their individual becomes eligible for SSDI and then eventually Medicare. In a typical scenario, after the parent starts to receive their own Social Security benefits, the child will start receiving SSDI 5 months later. After the individual receives SSDI for a total of 24 months, they will become eligible for Medicare. All totaled, from the time their parent retires to the time they are eligible for Medicare, is 29 months. So if you're eligible for Social Security Disability Insurance, SSDI, you're also eligible for Medicare. The other way to qualify for Medicare is to turn 65. Even if the individual has never worked, they can qualify for Supplemental Security Income, SSI, based both on their disability and their financial status. Because of that income status element, their financial assets must always stay under $2,000 in order to continue to receive SSI. This is one of the reasons occasionally a client will have a spin down to make sure their assets stay low enough to continue to receive SSI. SSI is tied to qualifying for Medicare. So if you're eligible for supplemental security income, you're also eligible for Medicare. Point to clarify, the gateway to receiving Medicare is Social Security. Social Security Disability Insurance is for people who have a long enough work history or their parent does. People who have never worked will not qualify for it. SSDI is the doorway to getting Medicare before you are 65 years old. When an individual turns 65, they become eligible for supplemental security income based on having an intellectual disability and low income. So SSDI or SSI makes you eligible for Medicare. Now that we understand how you qualify for Medicare, I'll explain a little bit about Medicare. Medicare is a federal program. Medicare has 4 basic parts. When an individual becomes eligible for Medicare, they are automatically enrolled in Part A of Original Medicare. Part A helps pay for hospital care. Part B pays for doctor visits. Part D helps pay for prescriptions. Part C plans are completely separate. Part C plans are Advantage plans. If you have an Advantage plan, that plan covers all of the services of Part A, B, and D. Many of our individuals with Medicare have Original Medicare, which is Part A. If they also have a Part B, it'll be printed on the same card. They will have a red, white, and blue card. Those with Original Medicare will also have a Part D supplement plan to help pay for their prescriptions. Some of our individuals have an Advantage plan, which is Part C. Advantage plans cover all of the services of Part A, B, and D. They will only have one card. Medicare Part A. If you have worked long enough, or you have a parent that has worked long enough, you will not pay for Part A. If you have not worked, not paid into the system for long enough, or have a very high income, you are still eligible for Part A, but you will likely have to pay a premium. The premium for Part A for someone with 0 work history points is $499 a month. Medicare Part B. Everyone pays for Part B. It's $170.10 per month in 2022, and that changes every year. This applies to anyone with Medicare, whether they have Original Medicare or an Advantage plan. The Part B premium is deducted from the Social Security check. If your only source of income is Social Security income, you are right to be concerned about how someone can pay for premiums, let alone the fact that they have co-pays, deductibles, and out-of-pocket expenses. Our individuals usually qualify for Medicare savings plans, low-income subsidies, and other programs like Medicaid due to their intellectual disability, their low-income status, and the fact that they live in a home or community-based program. You may wonder, do I have to have Medicare? No one can force you to have Medicare. That said, if you opt out of Medicare, you will lose any SSDI or SS benefits. Even if the individual qualifies for Medicaid insurance, Medicaid will not pay for someone who qualifies for Medicare, so that would also leave them without medical insurance. If you opt out of Medicare and then decide later you want it, you will have to pay penalties, and there may be waiting periods to get back into it. In the meantime, you'll pay for your medical costs out of pocket without any medical insurance. There are programs that our individuals qualify for to help them defray costs. Evergreen Life Services works with all available resources to ensure the highest level of care possible. I want to show you what the Medicare cards can look like. This is what an Original Medicare card looks like. You can see it says Medicare and Part A and Part B. This is the card you use for hospitals and for doctor visits. Part B also covers durable medical equipment like wheelchairs and rolling walkers. Part B also covers diabetic equipment like glucometers and strips. Most of our consumers also have a Part D. The Part D prescription coverage has a separate card. This is the card you take to the pharmacy. There are many different Part D plans, so cards can look different depending on the plan someone has. These companies offer not only Plan Ds, but also entire Advantage plans or private insurance plans, so the cards, the names, and what they're used for can get pretty confusing. A Plan D card should have the word Medicare somewhere on it and also have the RX symbol that means prescription. Why a Part D? People with Original Medicare, the red, white, and blue card, only have Part A, which covers their hospitalizations, and Part B, which covers their doctor appointments and DME. Part A and Part B do not cover prescriptions. Individuals must buy a Part D supplement to help cover the costs of their medications. Part D plans have a separate additional monthly premium that they have to pay. The average monthly premium for Part D is $33 for 2022. Lastly, to talk about are Medicare Plan Cs. Plan Cs are known as the Advantage plans. Advantage plans are different. Plan Cs combined all of the benefits of Plan A, Plan B, and Plan D. If an individual has a Plan C, they will only have one card. It should say Medicare and Advantage on it, and it will also have the prescription RX logo because Advantage plans cover all of the services the individual receives: hospital, medical, equipment, and prescriptions. Now that I've talked about Medicare plans, I will talk about Medicaid. Medicaid is different than Medicare. Medicaid is a state program that helps cover the costs of medical care for people with very low income. Remember, Medicare eligibility is based on whether or not someone receives Social Security. Medicaid is based only on income. Due to their low income status, the vast majority of our individuals have Medicaid, whether they have Medicare or not. Many individuals have Molina Medicaid, which is like Original Medicare. Some may have one of the Bayou Health Medicaid plans. Medicaid cards will have the state name on it, in our case, Louisiana, and the name of the Medicaid plan. Generally speaking, if an individual has Medicare, Medicaid will not pay for an individual's medical care or their prescriptions. Medicaid will reject any claims and tell the medical provider or the pharmacy that this individual qualifies for Medicare. They will want you to show your Medicare card, not the Medicaid card. Medicaid can also insist you get a Plan D, even if you don't want to pay for one, or you can pay for your prescriptions out of pocket. One of the most important things to remember is that Medicaid is last payer. They will only pay for something if the individual does not qualify for any other program. Medicaid is income-based. Usually our individuals have Medicaid unless their family pays for a private plan. Medicaid will not pay for prescriptions if the consumer has Medicare. Adults with Medicaid can find its coverage very limiting. It does not reimburse medical providers very well, so many will not accept it at all. An example is a dermatologist. In most of those cases, Evergreen pays for services directly out of pocket. Here's an insurance scenario. George and Julie. Both George and Julie are insulin-dependent diabetics. Each needs insulin, needles, lancets, lancet pen, testing strips, a glucometer, and a sharps container. How do their insurance sources pay for these diabetic supplies? Well, first of all, what insurances do these individuals have? Both individuals are under 65 years of age. George's parents paid into a Social Security system, and so he qualifies for Medicare. He also pays for a Part D to help cover his prescriptions. Because of his low income, he also qualifies for Medicaid. Julie's parents did not pay into the Social Security system. Since, like I said, she is under 65, she does not qualify for Medicare. Due to her low income status, however, she does qualify for Medicaid. How are George's supplies paid for by his insurance sources? Remember, George has Medicare Part A and Part B and a supplemental Plan D and Medicaid. Medicare Part B can be billed for his diabetic equipment and supplies. It is likely that Part B will not pay 100% for everything, so George will have an out-of-pocket expense to cover the difference. Part D will pay for his insulin. Medicaid will not pay for anything for Patrick because Patrick has other sources to cover his prescriptions. What about Julie's supplies? Julie doesn't have Medicare at all. She only has Medicaid. In her individual case, Medicaid pays for all of her supplies and her insulin with no out-of-pocket cost to her. That is not always the case because individual factors can affect coverage. I should also mention that Medicaid will not pay for anything fancy like sensors or insulin pens. They cover basic supplies. George does have Part B Medicare, which should help pay for his strips and glucometer, etc. As I said, however, Medicare Part B may not cover all of the costs of his supplies. Benefits are individualized, and reimbursement from Part B may be very little. In some instances, it may be better off to simply expect to pay for them out of pocket and look for the best price possible. Here the pharmacy did not run the strips through George's Part B. The pharmacy charged George $93.77 for 200 strips. Firstly, make sure the pharmacy runs the Part B. Part B may not always pay very much, but you won't know if it isn't run. George could buy his strips from a local pharmacy or Amazon for less. This is why it's always important to look at the home's monthly bills to see what is being charged and if there is a way to save money. Most insulin-dependent diabetics also have glucose tabs or gels in the home. You might automatically think that glucose tablets are a prescription and paid for by insurance. They are more likely treated as a basic over-the-counter item. You need to watch the explanation of benefits from the insurance to see the real story. You may be paying far more than you need to for items like this. You must watch your monthly bills to see that the insurances are being billed correctly and be willing to ask questions. I have called Medicare and Medicaid many times. Medicare has been easier to speak with. Medicaid is very helpful, but they tend to be more compartmentalized, meaning you may get transferred to a pharmacist for some questions and a different specialist for others. It's worth it to call and get your questions answered directly. You can learn to use the system more efficiently, saving money, time, and confusion in the long run. All Medicare plans have different premiums, co-pays, deductibles. Each individual has different diagnoses, medications, frequency of doctor visits, specialists, and equipment. Some programs require substantial skill in understanding plan elements to get the most benefit from the plan. Our individuals live in home and community settings that help, but also have their own set of rules and regulations that have to be considered when deciding what additional services may benefit them. If you have questions about an individual situation, please feel free to email. I'm still learning myself and do not have all of the answers, but I can help refer you to someone who does. Thank you for listening and have a great day.